Hey there, everybody. Ready for another deep dive? Today, we're going to be looking at acute kidney injury,
AKI.
AKI, a topic we found in some medical content by Medvarsity.
Fascinating stuff.
It is. We'll be exploring what AKI is, how it's diagnosed.
And the things that can make it tricky to spot.
Exactly. So let's just jump right in. What is acute kidney injury?
So AKI is basically a sudden decrease in kidney function.
Sudden how?
It happens over a pretty short period. We're talking hours or days.
Oh, wow.
Yeah, and this decrease, we can actually measure it by looking at a couple of things.
Okay.
Serum creatinine levels.
Right.
And urine output.
Both of those.
Okay.
And I think the sources actually had some specific numbers.
Absolutely, yeah. So to be diagnosed with AKI, you'd typically see a pretty significant increase in that serum creatinine level.
Right.
Like you'd be looking at an increase of 0.3 milligel
Within
48 hours.
Oh, yeah.
Or an increase of more than 1.5 times your baseline level.
Over
a week.
A week. Okay. So it sounds like that creatinine level is a pretty big deal.
Oh, it's definitely a key player, yeah. And then on the urine output side, we're looking at, well, how much urine your body's producing.
Yeah.
And less than 0.5 milliliter per kilogram of body weight per hour over 6 hours.
Wow.
That's when we start to raise an eyebrow.
A red flag.
A red flag.
Okay. So those are our two major parameters, creatinine, urine output.
Yeah.
But it sounds like diagnosing AKI, it's not always a slam dunk, is it?
It's not always black and white, that's for sure.
Right. And the research pointed out some pretty interesting nuances here.
Yeah, some really fascinating things. Like, did you know that your creatinine level, it can actually be affected by things like liver disease?
Oh, wow.
Muscle wasting.
Really?
And get this, even eating cooked meat.
Hold on. Cooked meat, why would that matter?
Okay, so creatinine, right, it's a byproduct of muscle metabolism.
Okay.
And cooked meat already contains creatinine.
Oh, I see.
So if you're eating a lot of cooked meat, it can bump up those levels temporarily.
Interesting.
It just goes to show that one single creatinine measurement doesn't tell the whole story.
Just one piece of the puzzle.
Yeah.
So what else can make things tricky when we're trying to diagnose AKI?
Well, certain medications can actually interfere with how creatinine is processed in the body. And then you have conditions like pregnancy.
Okay.
Where your filtration rate is naturally higher.
Right.
And that can make it harder to spot an acute decline.
So how do doctors account for all of this?
Well, that's where the AKI staging comes in.
Right.
To help, categorize the severity.
Okay.
AKI is actually divided into 3 stages, stage 1, 2, and 3.
And wasn't there a table in the Medvarsity material?
Yes. That shows how those stages correlate to the creatinine and urine output levels.
So it's not just like you have it or you don't.
Right.
There are degrees.
Exactly. There's a whole spectrum.
Okay. So what stood out to you as like the most important point here?
It's the reminder that creatinine, while it's super valuable, it's just one piece of the puzzle.
Okay.
You got to look at the whole picture.
So urine output.
Urine output, yeah.
And other factors.
Absolutely. Anything that might be influencing things.
To really get a handle on AKI.
Yeah, diagnose it accurately, and manage it properly.
So really understanding your baseline creatinine level is key here.
It's so important, especially with all these other factors we've been talking about.
Yeah, all those individual nuances.
Exactly.
Yeah.
Because, like we said, there's more to the story than just a number on a lab report.
Right, right. It's about context.
It is. It really is fascinating, huh?
Okay.
How something like a simple blood test can be so complex.
Yeah, totally. And speaking complex, we touched on those AKI stages earlier. Can we maybe dig into those a little bit more? Like, what do they actually tell us about what's happening in the kidneys?
Oh, absolutely. So think of the stages like a way to gauge the severity of the injury.
Right.
Stage 1, that's the mildest form. Kidney function is just slightly impaired.
Okay.
Then, as we move to stage 2, we're seeing a more significant decline.
Okay.
And then by stage 3, kidney function is severely compromised.
So each stage is like a different level of concern then.
Exactly. And it helps guide the treatment decisions.
Right.
Gives healthcare providers a better grasp of the potential risks.
The complications.
Yeah, exactly.
That makes sense. So we've talked about how we measure AKI. But what actually causes this sudden decline in kidney function? I know the research mentioned a whole bunch of factors, right?
It did. It's kind of like a detective novel, you know? You got to piece together the clues.
To figure out what happened.
Understand what led to the injury.
Yeah.
Sometimes it's a direct hit to the kidneys themselves.
Okay.
But other times it's more like a consequence of something else going wrong in the body.
It's amazing how interconnected everything is. Can you give us some examples? Like, what are some of the specific things that can lead to AKI?
Sure, yeah. One of the common culprits is actually medication.
Oh, wow.
Yeah, some medications, while they're essential for treating other conditions, they can be tough on the kidneys.
Interesting.
Like certain antibiotics, like aminoglycosides, they're known to potentially cause some harm to the kidneys.
So even medications that are meant to help can sometimes backfire a little bit.
It's true, yeah. And the studies also mentioned NSAIDs.
NSAIDs. What are those again?
Non-steroidal anti-inflammatory drugs.
Okay. So like ibuprofen.
Ibuprofen, naproxen. Yeah.
Like,
those are pretty common over-the-counter pain relievers.
right.
And while they're generally safe for short-term use, they can restrict blood flow to the kidneys, especially in people who are already dehydrated or have pre-existing kidney issues.
That's a good reminder to always use medications as directed and to talk to your doctor.
Always a good idea.
Especially if you have any concerns about kidney risks.
Yeah, for sure. And speaking of risks, dehydration is a big one.
Dehydration, yeah.
Huge player in AKI. Our kidneys, they need water to function properly.
Right.
And when we're dehydrated, there's less blood flow to those vital organs.
Makes sense.
Which makes it harder for them to do their job, to filter out the waste.
So staying hydrated is super important, especially when it's hot out.
Especially then.
Or if you're exercising a lot.
Yeah, exactly. You got to replenish those fluids. And it's not just dehydration. There are other things that can reduce blood flow to the kidneys, like severe infections or heart failure, things that can cause sudden drops in blood pressure.
Right, because the kidneys need that blood pressure, right?
They need that pressure to function properly.
To keep things moving.
Exactly. It's like, imagine a car engine. It needs enough fuel to run smoothly.
Right. Good analogy. And then there are also conditions that directly attack the kidneys.
Right.
Like certain autoimmune diseases or infections.
Infections, exactly.
So sometimes the kidneys are the target, not just a bystander.
Precisely.
Okay, what else?
The studies also talked about urinary tract obstructions.
Obstructions.
Yeah, kidney stones.
Okay.
Or an enlarged prostate.
Right.
Those can also contribute to AKI.
Yeah, I could see how that would be a problem. If something's blocking the flow of urine, it's going to build up pressure.
Exactly. Like a dam.
Yeah, and potentially damage the kidneys.
Yep. And these are just a few examples, of course. Right. The causes of AKI, they're really diverse. And often it's like a complex interplay of multiple factors.
It's not always a single cause.
Right. It's like a perfect storm.
Yeah. And this brings me back to that initial creatinine measurement we were talking about. It doesn't really tell us the whole story, does it?
No, it doesn't. It doesn't tell us the cause or the potential outcome.
So how do healthcare providers actually figure that out? How do they determine the root cause and what it means for the patient?
It's a mix of careful investigation and clinical judgment. You know, taking a thorough medical history, doing a physical exam, and then potentially ordering additional tests.
What kind of tests?
Well, it really depends on the individual and the suspected cause.
Right.
But, common tests include urine analysis. To check for infection or kidney damage, imaging like ultrasounds or CT scans to visualize the kidneys and urinary tract, and then blood tests to assess other organs, electrolytes, that sort of thing.
It's like using all the clues you can find.
Exactly, to piece together the puzzle.
And understand what's really going on.
Yeah, to get that full picture.
And is it like a one-time thing?
Oh, no. It's an ongoing process. Doctors, they closely monitor the patient's condition, adapt treatment as needed, and they reassess progress over time.
So it's not just about diagnosing AKI, it's about managing it too.
Absolutely.
And I know the research also mentioned that sometimes AKI can be a warning sign for other underlying health issues.
Yes, that's a very important point.
This has been really insightful. I feel like we've covered so much ground.
We have.
We've talked about the key diagnostic criteria, the things that can cause AKI, the fact that it's not always straightforward, and the need for a really holistic approach to diagnosis and management.
It's been a fascinating deep dive, and I'm sure our listeners are now much more aware of the complexity of this often silent condition.
Yeah. Before we move on, though, I'm curious about the things that can make someone more susceptible to developing AKI in the first place.
Oh, good question.
Like, what are some of those risk factors we should be aware of?
That's a great question. That leads us right into the realm of risk factors, which are basically, characteristics or circumstances that increase your likelihood of developing AKI.
So let's delve into those risk factors. What makes someone more vulnerable to AKI?
The research highlighted a few key categories. One major category is age.
Age, okay.
As we get older, our kidneys naturally, they become less efficient. So that makes us more prone to AKI.
Okay, so age is a factor. What else?
Pre-existing medical conditions.
Okay.
Those play a huge role. Things like diabetes, high blood pressure, heart disease, they all put extra stress on the kidneys.
So it's not just about the kidneys themselves.
No.
It's about the whole system.
It's about the overall health of the cardiovascular system, exactly.
Okay. What about lifestyle factors? Do those come into play?
Absolutely. The studies mention several, like smoking.
Okay, yeah.
It damages blood vessels everywhere in the body, including the kidneys.
Makes them more vulnerable.
More vulnerable to injury, yeah.
So that's another reason to quit smoking, everybody.
For your kidneys and your overall health, for sure.
Exactly.
And then there's obesity.
Obesity, okay.
Which we know is linked to, well, a whole bunch of health issues, including a higher risk of AKI.
I can see how that would put a strain on the kidneys.
It does, just like it strains other organs.
Yeah, it's carrying that extra weight.
It's the extra weight, but it's also the metabolic changes that often come with it. Things like insulin resistance, inflammation, which can damage the kidneys further.
Okay, so smoking, obesity, we talked about certain medications earlier. Are there other things people should be mindful of?
Yeah, actually. Some herbal supplements, while they're often marketed as natural, they can be pretty harsh on the kidneys.
Really?
Yeah, it's important to talk to your doctor before starting any new supplements, especially if you already have kidney concerns.
Yeah, just to be safe. Natural doesn't always equal safe.
Yeah, exactly.
What about those contrast dyes?
Oh, yeah, the ones they use in some imaging procedures. Those are another thing to consider. While they're generally safe, they can occasionally cause kidney damage, particularly in people who are already at risk for AKI.
So again, communication with your healthcare providers is key.
Absolutely.
Talking about those risks and benefits before you have any procedure.
It's all about making those informed decisions together.
Right. Now, I know we've talked about a lot of, scary things today.
You have.
But is there anything people can do to, actively reduce their risk?
Oh, for sure. And a lot of the preventative measures actually tie in directly with those risk factors. So managing existing conditions is huge.
So if you have diabetes,
hypertension,
get those under control.
That's going to minimize the stress on your kidneys.
Okay, so manage your health conditions. What else?
Maintaining a healthy weight. Quitting smoking if you smoke. And just following a balanced diet.
It all comes back to taking care of ourselves, doesn't it?
It really does.
And we can't forget staying hydrated.
Hydration's so important, especially when it's hot out or you're being active.
Right.
Dehydration is like a major AKI trigger.
And it's so easy to avoid. And what about those medications and supplements?
Always use medications as directed. Always talk to your doctor before starting a new supplement, especially if you have any concerns about your kidneys.
It's all about being informed.
It is, being proactive.
Yeah.
And for those who are at higher risk of AKI, regular monitoring of kidney function might be recommended.
Okay. So regular checkups.
Regular checkups, open communication with your doctor, and healthy habits.
Those are your best defenses. Well, this has been an incredible deep dive.
It has.
We've covered so much about acute kidney injury, from the basics to the risk factors, preventative measures, and everything in between.
It's been a really fascinating exploration.
Yeah, and I hope our listeners feel, more empowered now.
Empowered, yeah.
To protect their kidneys.
Absolutely.
And to seek help if they need it. What's the one takeaway you want our listener to walk away with?
For me, it's that AKI is often preventable and treatable.
Okay.
Especially if we catch it early.
Early detection.
Yeah. So by being aware of those risks, adopting healthy habits, and working with our healthcare professionals, we can really reduce the impact of this condition.
That's a really powerful message. And for me, the takeaway is that, AKI can be silent.
It can.
So it's crucial to be proactive about your kidney health.
Yes.
Even if you're feeling fine.
Regular checkups, open communication, healthy habits.
Can't say it enough. Well, that's all the time we have for today, everybody.
Time flies.
It does. We'll leave you with this question to ponder. How can we all work together to raise awareness about AKI and promote early detection? Keep those brains buzzing, and we'll catch you on our next deep dive.